Law enforcement in Oklahoma and across the country are dealing more and more with people experiencing a mental health crisis. And too often, those encounters end with a person being killed or injured. Jason Doyle reports on what's being done to change that.
People suffering from an untreated mental illness are 16 times more likely to be killed when they encounter law enforcement, according to the Treatment Advocacy Center. And nearly 1 in 4 Oklahomans are suffering from some form of mental illness, which means it almost certainly impacts someone you know.
We know mental health poses a lot of different challenges for individuals and our communities.
Mental Health Commissioner Terry White says services have not kept up with demand. In Oklahoma, only 1 in 3 people get the help they need. That leaves the majority untreated and vulnerable. Her department is trying to help with technology-based solutions.
The first pilot was actually in Northeast Oklahoma and has done so well. Oklahoma City is launching over 100 tablets in partnership with us for their police department to ensure that there is real, immediate access to a 24-hour, 7-day-a-week mental health licensed professional on the other end.
Police officers use the tablets to get help for someone in crisis instead of taking them to jail. Giving law enforcement the proper tools and training is saving lives.
Our first responders, our police and fire departments, are often called out to address somebody that is experiencing a mental health crisis. But far too often we haven't provided them for the training to recognize that and de-escalate that.
The Treatment Advocacy Center reports police transport 1 in 3 people experiencing a psychiatric crisis to emergency rooms for treatment.
Unfortunately, a lot of times we find ourselves taking the consumers to hospitals to get that stuff done. And if we had other locations, that would take the burden off of the hospitals to have to be our primary point of contact for crisis stabilization.
Master Sergeant Corey Nooner is a member of the Oklahoma City Police Department's Crisis Intervention Team. This week at Integris Baptist Hospital, he was helping train police officers from central Oklahoma on how to effectively communicate with someone in crisis.
So once safety is addressed, we talk to them about how to communicate with a person who may be seeing things that aren't there or hearing things that you can't hear. And obviously that can be incredibly challenging for our officers, especially when they're called to a situation where there's a risk for violence.
The State Mental Health and Substance Abuse Services Department partners with the Oklahoma City Police to provide the classroom training.
The 40-hour training to teach law enforcement how to better work with folks that have mental health issues when they encounter them in the community.
The program is funded through state and federal sources.
Federal funding allows us as trainers to go into rural Oklahoma where they are and help train them. So with that federal funding, we've trained the last year 100 rural police officers. The year prior to that, another 100 police officers in rural Oklahoma.
Congresswoman Kendra Horn is working with Senator Jim Inhofe and others to increase federal funding to give more first responders the opportunity to receive this vital mental health encounter training.
So our bill came about as a way to begin to address that, to help the first responders understand what they're encountering and to give them tools and the ability to de-escalate and get the individuals the care and the help that they need.
Right now, the fate of that funding is tied to the fate of the National Defense Authorization Act, which is currently in conference committee.
We've included 3 new mental health crisis centers in the MAPS package.
On the local level, Oklahoma City's 4th MAPS proposal will be voted on in December. It includes money for building mental health crisis centers, a restoration center, and 30 transitional housing units for those released from treatment or jail.
What we heard over and over in our conversations with Oklahoma City Police Department, Midwest City, the Sheriff's Department, that there are not enough safe places to take people who are in crisis.
If voters approve, it'll give first responders more options on where to take an individual in crisis. That, coupled with better training, should help law enforcement avoid deadly encounters. Jason Doyle, the Oklahoma News Report.